like to especially thank Pines International for the time and effort and expense that they have put into this program that we're going to be having this morning. And also their participation fee for this program has been donated to the Natural Products Quality Assurance Alliance. Now I'd like to introduce our speaker this morning. His name is Ron Seibold. Ron first spoke about the Green Foods Revolution in 1975. He envisioned this revolution as a means to create new organic communities. A rural sociologist, Mr. Seibold is responsible for many new ideas for organic farms and the communities that support them. He started the Wilderness Community Education Foundation, which turns chemically abused farmland into wilderness areas, wildlife refuges, and organic farmland. Currently, Mr. Seibold is president of Pines International in Lawrence, Kansas. He received a Master of Science degree in sociology from Colorado State University in 1971 and has worked with Kansas organic producers establishing organic growing and processing standards. He most recently served as editor of the book Cereal Grass, What's in It for You? A collaborative report on green foods and cereal grass research carried out by medical doctors and health scientists throughout the world. And I'd like to present to you Ron Seibold. Thank you.
Thanks so much. Good morning, and thank you for attending the Expo East Health Science Seminar Series. Our presentation this morning, as was mentioned, will focus on the role of nutrition, particularly vegetable nutrition, in the prevention of disease. I'd also like to thank the staff of Pines International for putting together the slides this morning and the materials that we're using for this presentation. Christy Boomhauer, who will be handling the slides, did the majority of the work here in the research and getting some of this material together. Phil McDonald, who's handling this camera here, and Pam Richards, who are here from Lawrence, Kansas, to assist with this. They did a wonderful job of getting all this material together, but no one could come up with a very good joke to start this thing off this morning. And I was wondering, does anyone have a good joke? If you do step forward, the one that we have, I don't know. I don't think I even want to do it. Come on. Well. Now you've made us interested. Well, you know, it's on the way over here. Just before I came over, I was reading the paper and I noticed that there's now been a government recall on all Mercury automobiles. You know the joke. Now, there's been a recall. They've found that some of these Mercuries have traces of tuna. Well, I said somebody could have come up with a little better joke. Well, today we're going to talk about the current American diet. We'll talk about why there's been a shift away from dairy and meat towards vegetables, fruits, and grains. And this has been by nutritionists, by the USDA, various health organizations around the country. We'll focus on some of the latest research findings from studies conducted over the past 10 years that had to do with disease and nutrition. We'll discuss the various nutrients that are thought to be keys to achieving better health, and we'll briefly look at the functions of these nutrients. Finally, we hope to provide you with more information about the benefits of green foods, especially naturally concentrated green foods such as wheatgrass and barley grass. We hope to show you how these naturally concentrated dark green leafy vegetables in tablet and powder form can help your customers get the green food nutrition that they need. But first, let me tell you what this seminar will not do. It will not provide a quick and easy cure for any particular disease. We're not going to try to sell you on any wonder drug or vitamin substance that is guaranteed to produce any particular results. Our focus instead will attempt to demonstrate how simple choices in what we eat and drink can greatly influence our overall health. The focus will be on prevention, not cure. We'll be talking about research findings that have been published by the U.S. government through agencies such as the United States Department of Agriculture, the Office of the U.S. Surgeon General. We will talk about research and statements by very respected organizations such as the National Academy of Sciences, the National Cancer Institute, the National Institutes of Health. All these federal agencies and highly respected medical organizations now recognize what most of us in this room have known for years. Good nutrition can prevent disease. With spiraling healthcare costs in the United States, most reasonable healthcare professionals, as well as some federal agencies, now recognize that the only way to solve the healthcare crisis is to teach people how to prevent disease in the first place. It is unfortunate that while many elements of our government are working to bring the truth to the American people about nutrition, others seek to lock the American people in ignorance. Let us hope that the new health care bills that will soon become law will reward doctors for keeping their patients well. Dr. Patrick Quillen will be speaking this afternoon at 5:45 on beating cancer with nutrition. He'll probably mention a couple of these facts that we took from one of his books. The cost per day of drugs to treat cancer is $900. One day in the hospital on the average costs $3,400. One open heart surgery can easily cost over $150,000. And the number of surgeries like this increase every year. By putting the emphasis on prevention of disease through nutrition and healthy living, that's the most cost-effective way to reduce healthcare costs. It seems so obvious. Do you know that 1/3 of all cancer deaths may be related to what we eat? Dr. Quillen says that it has now been well documented that various nutrients could prevent between 50 and 90% of all cancer. Most people in this room have always suspected that such statistics are true, but now the government itself is trying to tell us that these statistics are true. It seems absurd that studies linking nutrition and disease prevention have been conducted for thousands of years, but only now the government is accepting such research. This clearly demonstrates how long it can take for the government to get things done, but the fact is that attitudes are changing, and we should all rejoice in this wonderful change. Finally, many elements of government are recognizing the role of nutrition in the prevention of disease and the reduction of health care costs. In fact, the U.S. Department of Health and Human Services, the U.S. Department of Agriculture, the National Academy of Sciences, now all recommend Americans should eat a balanced diet, low in fat, which includes lots of vegetables and fruits. Now, this recommendation, of course, it seems very obvious to all of us, but it's exactly the polar opposite of what our government was recommending in the past. It is the opposite of what most Americans have come to believe is a balanced diet. The standard American diet, as we all know, is high in fat, high in cholesterol, high in sugar, low in fiber, and low in vegetables and fruits. Accordingly, the standard American diet produces a high risk of chronic disease. The USDA has finally addressed this problem with the introduction of the food pyramid to replace the 4 food group diet recommendations of the past. And most of us have all seen this, but let's quickly review it. The old 4 food groups put the emphasis on protein and dairy intake, but the new food pyramid takes the focus away from protein and dairy intake and stresses the importance of vegetables, fruits, and grains. The food pyramid now recommends that these kinds of foods make up the majority of one's daily food intake. The pyramid recommends eating 3 to 5 servings of vegetables per day. And you can see that they also recommend 2 to 4 servings of fruit. So there's a total of about 9 servings of fruits and vegetables at the maximum they're recommending, but they even have gone as far as to say in some of their press conferences, eat all you can, the more the better. This new recommendation reflects an increase of 100% over the old model known as the 4 food groups. According to a study conducted by the National Institutes of Health, 66% of the population in the United States thinks that only 2 servings of vegetables per day is enough. while only 8% think that 5 servings are enough, and that's what's currently being recommended, up to 5 servings or more a day. The USDA took another giant step forward in its healthcare reform with the introduction of the 5-a-day program. This program urges Americans to eat, again, at least 3 to 5 servings of vegetables per day, with most of them being the dark green leafy type. Not necessarily head lettuce, but the dark green leafy types, kale, spinach, things like that. 3 to 5 servings. Many national health organizations are publishing consumer education pamphlets and brochures that attempt to increase the awareness of vegetable nutrition in the prevention of disease. Their recommendations are not based on 1 or 2 studies. They're based on hundreds of studies conducted over the past 20 years, all of which have established a link between nutrition and the prevention of certain diseases. In fact, the Surgeon General of the United States and the National Academy of Sciences, which include our most decorated scientists, have endorsed a nutrition to cancer link. This is the Surgeon General, not the FDA, the Surgeon General. The data on nutrition and cancer have become so overwhelming that the National Cancer Institute is now spending $100 million annually to investigate the prospects of using nutrition to prevent cancer. This is just a drop in the bucket, I guess you could say, when you consider the National Cancer Institute has a $1.8 billion budget, but it's a step in the right direction. We'd like to summarize for you specifically what these respected health organizations have concluded. The National Cancer Institute determined that only 9% of Americans eat a diet that will prevent disease. Think about it. Only 1 out of 10 of your customers are eating enough vegetables, enough fruits. They're eating too much fat, too much meat, too much dairy products. To answer those questions about what type of diet has been shown to prevent disease, the National Cancer Institute's answer is, and I quote, "Research on the role of diet and the cause and prevention of cancer shows that some food components or dietary patterns may influence a person's risk of developing certain types of cancer. Scientific studies suggest that vegetables, fruits, and foods high in dietary fiber and certain vitamins may protect against cancer, whereas a high intake of dietary fat may increase cancer risk." Consider what that will do when people start eating right in terms of the national health care costs and the cancer incidence. In putting together this seminar, it is clear that the nutrients most commonly related to the prevention of disease are as follows: fiber, beta-carotene, vitamin C, and in some cases vitamin E. Again, dark green leafy vegetables. Now, fiber has long been associated with reduced risk of cancer of the colon. The pamphlet, The Great American Food Fight Against Cancer, which is published by the American Cancer Society, says, and I quote, "Studies seem to support an association between high fiber diets and low incidence of cancer and other diseases of the colon. The exact mechanism is not known, but could be related to the dilution of intestinal contents and the speeding up of their passage through the colon. The U.S. Department of Health and Human Services, in a publication released in conjunction with the National Institutes of Health and the National Cancer Society, recommends that a diet high in fiber and low in fat may reduce the risk of cancers of the colon and rectum. Americans now eat about 11 grams of fiber daily. The National Cancer Institute recommends that Americans double this amount of fiber to eat between 20 and 30 grams daily. And looking at some of the other nutrients being studied, the National Cancer Institute has concluded scientists who study the food people eat in different countries are finding that diets rich in beta-carotene and vitamin C are associated with reduced risk for certain cancers. Again, where do you get beta-carotene and vitamin C? Dark green leafy vegetables. The American Cancer Society adds that studies suggest that foods containing vitamin A, which the body makes from beta-carotene, might lower the risk of cancers of the larynx, esophagus, lung, and bladder. Studies indicate that foods containing vitamin C may protect against gastric and esophageal cancers. As you're probably aware, in order for any health organization, especially organizations like the National Cancer Institute and the National Cancer Society, to publish the information we've just quoted, they have to have overwhelming overwhelming amounts of scientific research to validate these claims. Clearly, everyone is agreed that vegetable nutrition is essential for the prevention of many cancers. It has increasingly now become a part of the treatment of many cancers. In the past, the medical profession has worked under the assumption of starving the tumor to decrease the cancer, to stop the cancer. This has all changed now. It is now known that one of the major problems with cancer patients is malnutrition. In fact, over 40% of cancer patients die from malnutrition rather than the actual cancer itself. This may be due to the fact that cancer causes lean tissue wasting as the body cannibalizes its own reserves. Tumors are major parasites that drain the nutrients from the host. Further, many cancers can cause a loss of appetite. An added problem is the side effect of chemotherapy treatment. Chemotherapy kills rapidly dividing cells, of which 80% are cancer, and the other 20% are healthy cells, but they're all killed by the chemotherapy. And the ones that are killed that are good healthy cells are primarily in the tongue and the gastrointestinal tract, and the hair, nails, and immune system. Chemotherapy can also cause patients to experience nausea and fatigue. The only cure to malnutrition is nutrition. So it seems imperative that cancer patients must incorporate nutrition into their treatment, regardless of what the treatment. They need good nutrition. It is due to these more recent findings that nutrition has come back in the spotlight as a preventative measure against and a therapeutic treatment for cancer. The more current research began in the early 1980s after the National Academy of Science published a technical book endorsing this cancer to nutrition, nutrition to cancer link, with what many considered an unscientific, exuberant proclamation. Spread the good news. Cancer is not as inevitable as death and taxes. Since that time, hundreds of studies have been published demonstrating that this nutrition to cancer link. Among them a report in the journal Nutrition and Cancer that provides the results of over 200 individual studies examining the relationship between vegetable and fruit intake, and 10 different cancers, including cancers of the lung, colon, breast, cervix, esophagus, oral cavity, stomach, bladder, pancreas, and ovary. Statistically significant protective effects of vegetable and fruit consumption were found in 128 of 156 dietary studies. According to a study in the journal called Current Opinion in Oncology, smoking cessation, moderation of alcohol consumption, and increased consumption of vegetables and fruits have been identified as 3 actions that could lead to the prevention of approximately 3/4 of the cases of cancer of the oral cavity and larynx. Dr. Quillen notes a very convincing bit of research on the link between cancer and nutrition that occurred at the University of British Columbia. They studied a spontaneous regression, those cases where miraculous cures appear, usually after traditional therapies have been given up. When 200 of these miracle patients were studied, it was determined that 87% of those 200 patients who made this miraculous cure made serious dietary changes, which were mostly vegetarian in nature, while others went through some kind of detoxification program or used nutritional supplements. Clearly, the evidence of the change in attitude in the medical establishment came recently when Dr. Dean Adele, the one who is known to most Americans through his nationally syndicated health news talk program that's on a lot of networks, said, and this was just all he said, was people with low fruit and vegetable intake experience twice the risk of most cancers. This is the AMA. The most recent discovery in nutrition and disease is a link between increased vegetable intake and the prevention of heart disease, according to an article, April 13, 1993, in the Washington Post. Carrots, spinach, and other vegetables and fruits that are also high in vitamin C, E, and beta-carotene have long been linked to decreased risk of cancer. But now, the latest scientific evidence suggests that these nutrients may also provide some protection against stroke and heart disease, still the #1 cause of death in the United States. The American Heart Association has recently reported that women who eat 5 servings of vegetables a day reduced their risk of chronic heart disease by by 54%. Numerous studies have shown that increasing vegetable and fruit intake decreases cholesterol levels. Perhaps this explains why vegetables are now linked to prevention of heart disease. But I'm not really speaking for Pines International. I'm not speaking for myself. I'm not speaking for our staff here. I'm speaking for the federal government. I'm speaking for the most respected health organizations in the United States. I'm speaking for the American Medical Association when I say that various nutrients found in green vegetables can provide protection. The recommendation of the government and healthcare providers around the world is that we add these nutrients to our diet through the food source itself. As stated in the Great American Food Fight Against Cancer, published by the American Cancer Society, food is the best source of cancer prevention. Vitamin and mineral supplements are only supplements, they're not substitutes. Well, we hope that we've convinced you of the importance and benefits of eating more vegetables. Now we'll look at a practical way. Many people think they eat a lot of vegetables, but when you look at their diet, maybe they only need a couple or 3 servings a day, and perhaps it's a light green salad that contains very little chlorophyll or beta-carotene, contains very little dark green nutrient-rich, nutrient-dense materials. So people are looking for a practical way to increase their intake of deep green leafy vegetables in their diet without having to create a whole new diet. And of course what I'm speaking of this morning is the addition of 100% pure cereal grass to the diet, and how cereal grasses can significantly increase one's intake of these disease-preventing substances, including fiber, beta-carotene, chlorophyll, vegetable protein, vitamin C, folic acid, calcium, iron. The list goes on and on. The Pines International has never endorsed replacing vegetables such as spinach or broccoli with green foods. Rather, we promoted the idea of adding additional servings of vegetables to the diet long before the USDA came up with their 5-a-day program. It is clear to us that most Americans, and the statistics bear this out, have a very hard time consuming 5 servings of vegetables a day. Yet the benefits associated with increased vegetable intake are very, very great. Cereal grass tablets, that is wheatgrass or barley grass tablets, provide an economical and convenient source of deep green leafy vegetables. 7 tablets is a serving, equivalent to a dark green leafy salad made of spinach or endive or kale. No other dark green leafy vegetable is as concentrated as wheatgrass and barley grass when they are grown properly. Cereal grasses such as wheat and barley are the young green plants which grow to produce wheatgrass and wheat and barley grains. They grow slowly over the winter. They're only about 8 inches tall when they're harvested in the spring. And the consumption of wheat and barley grasses date back to the Mesopotamia era when it was said that people in the Middle East ate the green leaf tips of wheat as a delicacy. But bottled dehydrated cereal grass has been a popular food supplement, or food actually, for people, a concentrated, naturally concentrated food for people in the United States since the early 1930s. This was shortly after the original research on cereal grass revealed that when cereal grass is grown in a conducive climate and harvested at a crucial time just prior to the joining stage in the spring, the plant has a nutritional profile very similar to that of the most concentrated dark green leafy vegetables, but even in greater concentration. Dehydrated cereal grasses were accepted as foods by the American Medical Association in 1939. The AMA accepted all cereal grasses as food, including wheatgrass, barley grass, oatgrass, ryegrass, and so on. Many people ask what the difference is between wheatgrass and barley grass and the other cereal grasses. The fact is they're all identical in their nutritional profile. All cereal grasses are virtually the same in appearance, in color, in flavor, and nutrition at the joining stage. There is really no measurable nutritional difference between wheatgrass and barley grass when they are grown in the same conditions. Now, when we say that wheat and barley grass must be grown under certain conditions to produce the high levels of nutrients that have been discovered in the research, we mean specifically that the growing cycle should be a full 200 days. Planted in the fall and in a temperate climate, usually in the Midwestern states, and allowed to go dormant over the winter to allow the maximum absorption of nutrients through the roots. When wheat, for example, is planted in a climate like Kansas in the fall, we've all seen wheat sprouts and how they grow in a tray, in a warm window box or in a greenhouse. In about 7 days, you've got about this much growth and hardly any root. This is not the way wheat grows. It's normally planted in a climate like Kansas in the fall, when the temperatures are beginning to get cool. The soil itself is still fairly warm, but the nighttime temperatures are getting down into the 40s and sometimes the 30s and sometimes below freezing. What this kind of growing condition does is it forces the wheat plant or the barley plant to use the carbohydrate that's in the grain to produce roots that go deep into the ground. So what the difference is between planting wheat in its natural climate versus growing it in a tray is that in a tray you'll in 7 days get this much leaf and hardly any root. When you plant it in its natural condition outside in the fall in a climate like Kansas, in 30 days you end up with 15 inches of root and only about 1 inch of leaf. The plant is getting ready for winter, is putting its roots down the ground. So that full 200-day cycle is very important in building that nutrient concentration in the leaf. The plant becomes lush green in the spring and grows to a height of about 8 inches after this long winter. And it grows to 8 inches over a period of about 60 days, so it gets a very, very concentrated level of beta-carotene, chlorophyll, all these vitamins and all that are associated with dark green leafy vegetables. It is harvested during a very short period in the spring when the chlorophyll, protein, and nutrient levels are at their peak. As a matter of fact, this amounts to about 4 days out of the 200-day growing cycle. There's only about 4 days where the plant reaches that absolute peak level of nutrients. That's why in Midwestern states such as Kansas, that's the best region for producing wheat and barley. So when it's grown into those proper conditions and harvested and is 100% pure, it's not a lot of maltodextrin and alfalfa and brown rice and things added to it. When it's 100% pure, 3 servings, 3 teaspoons or 20 tablets is equal to 3 servings of vegetables. So if most people are eating 2 servings of vegetables a day, by doing 20 wheatgrass tablets or 3 teaspoons of wheat or barley grass powder in its 100% pure form, you can make up and get the 5 servings that are recommended by the USDA. In fact, gram for gram, wheatgrass and barley grass contain 91%, now this is 3 servings, 20 tablets. You're getting 91% of the recommended daily allowance of vitamin A, 53% of C, 34% of E, 16.5% of the dietary fiber, 58% of the folic acid, 50% of the iron, 150% of the B12, and B12 is not used in dark green leafy vegetables, but wheatgrass and barley grass, cereal grasses have a very high level of it. 7% of the calcium, 53 milligrams of chlorophyll, 20 amino acids, including the 8 essentials, and those amino acids are in what the World Health Organization calls the ideal percentages. Well, I'd like to thank everyone for attending the seminar. We hope we've provided some compelling and factual information. Again, thanks everyone for coming, and a great expo.